the arrow shows. So what's the symptoms and how to do the diagnosis of silicosis? For the silicosis patient, from the picture you will see the left one is from the lung specimen with the silicosis. Then you will see the large black nodule. The arrow shows this one, this big, large black nodule. And compared to the normal, the whole lumps turn to black and turn to be very hard. You can't see the normal structure of the lumps. And usually, the symptoms appear only after 20 or more years of exposure to the silica for the chronic silicosis. But in some occupationals with the high level and exposure to the silica dust not quite a long time, the symptoms may appear in less than 10 years. So it depends on the exposure time and the exposure concentration of the silica dust. The symptoms are different. You will see people with simple nodular silicosis usually have no trouble breathing. So for this kind of patient with the simple nodular silicosis or not many big size, they don't have any breath problem, but they may cough. Because the lungs tend to be not flexible, so sometimes when they breathe, they can't breathe normally, especially getting drier, so it may cough. For a tuberculosis patient, if the patient with silicas get together, the tuberculosis is a common complication of the silicosis. So how to diagnosis of a silicosis patient? We need 3 different things. The first one should have a positive history of exposure to free silica dust. During investigation, ask the patient his job and ask the occupational exposure to the silica dust. And go to the working place to do the measurement of the silica dust to make sure the concentration of the silica dust in the working place. And you will also find the patient at an early time, they will have irritant cough. This is a dry irritant cough. And later, with the exposure time increased, the symptoms will show different. The patient may with shortness of the breath. So the lung function to do the diagnosis of silicosis is very important. From this picture, you will show the silicosis patient with the restrictive disease, this with restrictive lung function. They can't breathe normally. So the shape of the lung function changed. And from the X-ray, you also can find the different from the normal X-ray. The right picture shows the normal X-ray. You will see on the top and the middle and the bottom. For the silicosis patient, first you will see the whole lumps from the X-ray. The color quite different, getting black. And you will find an arrow showed nodule, this nodule here, and you will also can find the nodule here. And for this patient, you may find more nodule. For example, here, this is a small size one, and you also can find the big one. This is a large mass of the nodule. For some patients, you may find the PMF. This is quite a big one. So, X-ray can find the eggshell appearance of the lymph nodes. This you may find, and here also can show some nodules. And at the same time, tuberculosis patient is the most common complications among workers with silicosis. You will find the big nodule here and here from the X-ray. So when we do the diagnosis of the silicosis patient, X-ray will be very helpful. And at the same time, you have to distinguish the silicosis patient from the cancer patient. The lung cancer patient also can find the nodules. And the very important things, you should ask the patient their occupational exposure. The occupational history for a silicosis diagnosis is quite important. And you may also do the lung functions. The lung function, for the early time, the silicosis patient show the normal lung function. But at last, you may find a restrictive impairment for the patient. So this is the diagnosis and the symptoms of the silicosis patient. How to do the treatment for the silicosis patient? There's no drugs special for this kind of patient. So prevention and control the dust in the working place is very important. And controlling silica dust in the workplace is the key to preventing the silicosis. The workers, during the working time, they should wear protective gear. For example, they should wear a special mask and wear the special clothes and uniforms and wear the gloves when they're doing something in a working place full of the dust. And the workers exposed to the silica dust should have regular chest X-ray for every 6 months, or for the sandblasters, and every 2 to 5 years for other workers. So they have to detect early what happened to their lungs if they exposure to the particles. If the X-ray shows the silicosis, the doctor will probably advise the workers to avoid continual exposure to the silica. But we already know, even we avoid continual exposure to the silica, but the silica already in the lungs will not be easily destroyed by our immune systems or other cells. So the silica inside the lungs can continue damage our lung tissue. So that is why the chronic silica patient, you may find after 20 years, they will have the symptoms. And the treatment, the silicosis cannot be cured, but it is progression. The progression can be slow if the patient avoid to exposure to the silica. And a patient who with difficult breathing may benefit from the treatments used for chronic obstructive pulmonary disease. So they can use the drug therapy to keep the airways open and free of mucus. So it can help them have the normal life when they do the treatment, but it won't help them to cure this disease. And at the same time, we have to know the tuberculosis is quite common with the silicosis. So they should have regular check-ups that include a tuberculosis skin test. And smoking is very dangerous for the silicosis patient. So smokers who work around asbestosis or the silicosis should have a higher risk of the lung cancer. And we have an important change for the silicosis patient. The International Agency for Research on Cancer, they reclassified crystalline silica as the class 1 carcinogen. So for the class 1 carcinogen, we have to very carefully do some prevention for the workers in a working place which can exposure to different particles.